Hi, my name is John Hishar. I'm the business manager of Associated Dental Specialists, and I'd like to reach out to patients and referring doctors who may have some concerns in regard to safety and infection control at Associated Dental Specialists during the COVID-19 pandemic. When it comes to infection control in the dental office, it may seem like a no-brainer that certain behaviors like wearing a mask, social distancing, washing hands, continue to be the most powerful in regard to stopping the spread of the virus. In 1993, the CDC developed infection control recommendations for dentistry. ADS took the lead, and we have mastered infection control in the clinics. We also monitored the guidelines of the ADA, the AAE, the Pennsylvania Department of Health, and the Commonwealth of Pennsylvania. And we incorporated these guidelines into an ADS operating procedure. These guidelines evolved over time, and our operating procedures did as well. Associated Dental Specialists has been open and treating emergency patients since the beginning of the crisis. So we've been doing this for a while, and we know what we're doing. First of all, we screen ourselves as we would screen our patients. So we screen ourselves before the patients come into the office. We do so by screening for symptoms, taking our temperatures, and basically keeping our staff and doctors on the same level of standards as far as safety that we ask of our patients. We also pre-screen the patients before we schedule them. We have a triage, pre-screening set of questions that we ask them relative to the COVID. And if they pass, then we schedule them. We do tell them at that time not to bring unnecessary personal belongings to the office. Otherwise, they can keep those things in the trunk of their car. We just don't want them bringing them into the offices. When the patients arrive in our office, they will see a barrier, a plexiglass barrier between them and the ADS staff. In addition, if the patient does not have a mask, we will provide a mask to that patient. Now, we will have hand sanitizer available for the patients. We will also ask the patients to wash their hands. When the patients are completing the registration forms, we will give them disposable take-home pens. We will also give the patient a pre-procedural mouth rinse of hydrogen peroxide, which basically neutralizes bacteria and virus for several hours. When the patients go back into the clinic, they will see our staff and doctors donned in the personal protective equipment. And behind that mask, behind the face shield, behind the goggle, is the smiling ADS endodontist. Now, when we perform aerosol generating procedures, we use a high volume suction to remove the particles that are in the air. We have also purchased and installed air purifier units in our operatories. And this is a 3-filter process, and it does include a HEPA filter, which removes and sterilizes, disinfects, and neutralizes the bacteria and the viruses in the air. Now, the disinfecting, the deep cleaning between patients that take place in the clinic, we are also cleaning and disinfecting at the front desk area and in the waiting room throughout the day. And in addition, we have a procedure or two that we limit to the last appointment of the day. And the reason for that is we can totally disinfect at the end of the day and perform our day-end procedures. While we're presently up to date as far as the guidelines from the various authorities, we continue to monitor the progress, and we will get the latest up-to-date technology into the ADS offices and clinics. Thank you for your attention, and thank you for your trust in Associated Dental Specialists and the continuing referral relationship we have with you. If you have any questions, feel free to reach out and contact us. Stay safe, stay healthy, and we'll see you on the other side of this pandemic.